Okay, guys, this is Chapter 6, Lecture 5. Today, before you leave, I need your handwritten notes handed in to Mrs. L, and Mrs. L will check them over. Yeah, and I don't know why. Mrs. L will check them over for you and give them back to you. Maybe assign some points. So you need to watch this over. It's only 10 slides. It shouldn't take too long. Okay, so let's see what we have here. Okay, common skeletal disorders. Arthritis. Arthritis is inflammation of the joint or the synovial membrane. That is the definition. It's a general term that's used. I have arthritis, but then you can break it down to even more. Osteoarthritis, the etiology, that means where it stems from. Joint cartilage wears out by old age, by sporting injuries, by trauma, obesity, or a family history. Okay? The signs and symptoms are painful inflammation, wearing away of joint cartilage, and your joints can have a crooked deformation. So you're going to go in, you're going to complain of some inflammation, you might be obese, and you're going to complain in your knees, and your knees may even be deformed a little bit. So the doctor's going to take a good patient history, he's going to do some x-rays, he's going to do a visual exam, and then what he's going to do is give you some analgesics. Do you know what an analgesic is? You should, because we've done the pharmacology. Analgesics? Anyone? Pain medication. That's what an analgesic is. Anti-inflammatory medications. Steroid injections. That's where you're going to get a shot right into the joint that's affected. Surgical intervention. We've seen the knee replacements, joint replacements. And of course, they're going to ask you to do some non-weight bearing exercise. And pool exercises are really good for that. Rheumatoid arthritis, that is an autoimmune disease. So your body is attacking the connective tissue. And it can not only attack the connective tissue like in your joints, but it can in your lungs and your heart as well. And in your book, if you're doing your reading like you're supposed to, you're going to see that 3 times as many women as men develop this condition. Hint, hint, that might be a test question, okay? Because your book is specifically pointing that out to you. So with rheumatoid arthritis, this is the arthritis that when you look at someone's hands, you'll see that they're very deformed, and they're very crooked, and they're very deformed, and it's painful. Okay, it's painful. My husband's grandfather had rheumatoid arthritis, and back then there wasn't as many treatments as there is now, and he was actually bedridden. My father-in-law never knew his dad ever standing, and in huge amounts of pain, lots of pain. So there's stiffness, there's swelling, lots and lots of pain, and it can affect multiple joints, and then pronounced joint deformities. Some of you may have grandparents or great-grandparents that have rheumatoid arthritis. So the doctor's going to do a visual examination. He's going to look at you, order some x-rays, and he's going to draw some blood, and he's going to do an antibody screening. Rheumatoid factor is what he's going to be looking at. And he's going to take a really good patient history. And then he's going to say, yeah, you do have rheumatoid arthritis. So what are we going to do? Well, we always do the least invasive, or hopefully that's how we start. And we give people like aspirin and non-steroidal anti-inflammatory drugs. Corticosteroid medications like methotrexate. Hint, hint. That is a cancer drug, and that is a drug that you can use for your PowerPoint this week, along with aspirin. And a lot of times they'll give you medications that are going to suppress the immune system, okay, like Humira. because that's what rheumatoid arthritis is. It's an autoimmune disorder, and it's the body attacking itself. So if they suppress that, then you're not going to have these huge exacerbations. Okay? And then you'll do simple rest and range of motion exercises. And then in some cases where it's really extreme deformities, you might have some surgical intervention. You got that? Okay, septic arthritis. Septic arthritis. I bet you never knew there were so many different kinds of arthritis. This is when you have an infection inside your joint. Okay, sometimes you have a penetrating joint wound. Okay, so what does penetrating joint wound mean? Penetrating joint wound. Okay, think about it. Or a pathogen that's carried in your blood. You're going to get pain, you're going to get swelling, you're going to maybe have pus. That's what that exudate, right? Inflammatory exudate, pussy stuff. Destruction of joint and replacement with fibrous tissue and eventually bone. It's not good. It's not good. I don't think I've ever seen it, but it doesn't sound good. Septic arthritis. So that you're going to come in, maybe the doctor does a patient history on you, and you have some pain and swelling, and he notices maybe that your joint is full of fluid and maybe pussy stuff. It might even be oozing because it's so edematous. It might be hot. He'll maybe order a fluid culture. So if that's the case, he might drain wherever the joint is and then culture it up. When we talked about cultures, I believe it was chapter 3. And then what they're going to do is they're going to give you antibiotics. Okay? They're going to give you antibiotics, and when you clear the infection, the arthritis might calm down, go away. You can prevent septic arthritis with good aseptic technique. What's aseptic mean? Aseptic. Anyone? Anyone? Bueller? Bueller? Okay. I hope you're laughing. I hope you think this is funny. Better day than today. Bursitis. Bursitis is inflammation of the bursa. It stems from repetitive movement, strain. You can have a congenital defect. Again, what does congenital mean? It means you're born with it. Or you could have a rheumatic disease. So you have pain on movement, limited range of motion, inflammation, and swelling at the affected site. Okay? So doctor's patient history. Is that ringing a bell with you? We do a patient history all the time. Visual exam all the time. We have to look at our patients. And then x-ray. Okay, and we learned about x-rays, what, in chapter 2? Treatment, rest, moist heat, cold therapy. Okay, cold therapy might really aggravate it, so you'd stay away from it. Analgesics, anti-inflammatory medications, corticosteroid injection at the affected site. You might want to drain the fluid, do range of motion exercises, and then once the pain's gone, you can restore to full joint motion. Cruciate ligament tears. That's a tear in one or more supporting ligaments of the knee. Some of you probably are familiar with this, with your sports. Trauma. When the leg is twisted, the leg receives a blow. Okay? You can get pain in the knee, instability of the knee. You could have limited mobility of the knee. Okay? So the doctor's going to do a physical exam, probably order an MRI, immobilize it with a knee brace, and you're going in for surgery. Okay? You're going in for surgery. Next is gout. I probably told you guys this story before. My dad was diagnosed with gout, and he had an exacerbation of gout on my wedding day and didn't think that he'd be able to walk me down the aisle. Big toe is most commonly involved, and it gets really big and it gets really swollen. You can't even lay a sheet on the toe. It hurts so bad. Very, very painful. Toes warm. You go to touch that toe, it is really warm. But he did walk me down the aisle. He got his cowboy boots on. Gout is a metabolic disease where uric acid levels become too high. Okay, and what it does is it causes uric acid crystals to deposit in your joints. So your toe is most common, but I have seen gout in people's hip bones, and I've seen gout even in the spine. My husband's uncle had gout in this, and it affected his spine. So it can be very painful. All right. It was once said to be, I think, a disorder of the rich, because they used to say it. You'd get, you'd eat it. You'd get gout from eating large amounts of protein, rich foods like liver and seafood. Okay. So they're going to do a visual examination. That's the diagnostic test, and they're going to do a blood test. Okay, to see how much uric acid you have floating around in your body. So what they're going to tell you to do is restrict your dietary protein. Okay, too much of it can give you an attack. It can precipitate an attack. And they'll tell you to go on a low-fat dairy product diet. You're going to rest. You're not going to want to move. They're going to give you analgesics and anti-inflammatory medications. And then there's specific medications that you can take for gout, which they've been using for like 1,500 years. See this nice big fancy word right here? I don't know how to pronounce it, so sorry. Kyphosis, humpback. I've talked about my husband's uncle who had kyphosis, and when he would lay in bed in the hospital before he passed away, it would be very hard for him to get in to get comfortable. You can get humpback. You can be born with a humpback, or you could be born with kyphosis. You could have osteoporosis. You'll see a lot of times older women, they hunch over and they get that humpback look. Trauma and polio. Getting polio can be a way of having kyphosis. So kyphosis, you guys, I say humpback, you automatically get that picture of the humpback. And what it is an exaggerated curve of the upper back. Lots of back aches. And you can have pulmonary insufficiency. So what does that mean? Think about it for a minute. Pulmonary insufficiency. Pulmonary, we're talking about the lungs. Insufficiency means not good enough, right? So dyspnea, you see the word dyspnea here. Can you think of what dyspnea is? That's right. You guessed it right. Dyspnea, short of breath. You could tell someone has kyphosis by visual examination and by x-ray. And what they're going to do is they're going to probably treat the symptoms and the severity. So maybe you get some exercise so it can take away some of that back pain. Maybe bracing, surgery if it's bad enough, and weight control. All right, are you with me so far? I don't think, oh, that's it. That is it for today. So what you need to do is you need to do your notes and hand those in to Miss L and continue working on your work. Today's Wednesday, so you do know that you have your Henrietta Lacks due today by the end. There's 2 chapters that you're doing, and I think there's only a total of 9 questions, so it's not too bad. Alrighty, we will talk to you again tomorrow.